Good. Nice. All right. How'd that feel? Nice. So today what we're going to show you is a very decompressing adjustment we found has worked best for Joni. Joni takes care of a lot of kids, and we know that puts a lot of pressure in that spine. So we're going to do 2 adjustments there, and let's go ahead and do that now. Are we good? Okay, go ahead and go face down. Let's come over here. So with Joni, first what we're going to do is assess her leg length. And sure enough, we're going to see that her right leg is in fact much shorter than her left. Go ahead and bend your knees, Joni. And we have a lot of knee restriction as well, so we want to acknowledge that. Because her leg length was long on the left and it actually got shorter when I brought it in that second position, we know that her pelvis is actually rotating up and forward on the left. And it's going to be hard to see on camera, but that is very obvious to me. And I think it's also pretty obvious to Joni as well. Can you feel that, Joni?
Yes,
right?
I sure can.
Now, from the chiropractor's standpoint, though, I'm going to feel her way more posterior rotated on this right side. And when I start really digging there, she's going to really start feeling it. And the reason why it really stands out to me, because if you can imagine, her pelvis is actually rotating back and down this way. And her hip, which is in the front, which will extend her leg, will actually be pulled up this way. And so that is going to put a ton of posterior rotation, which is where the chiropractor feels it, but it rotates forward, which is typically where the patient's going to feel it, because it puts all the pressure on the joints and the little nerves in the lumbar plexus there. So to help decompress, we're going to decompress using this decompression table. It's a flexion distraction. So as it distracts her, it also flexes. It lengthens the disc, which is very soothing. How does that feel, Joni?
Oh, it feels good.
Yeah.
I feel it stretching.
Yeah. And we're also going to decompress the insertion muscles of the knee. So we've got some the muscles most commonly known here. We've got the hamstrings are out on the lateral side, the bicep femoris, and on the medial side, the semimembranosus and tendinosus. And we just want to traction from those positions. As we traction, you'll see my hand up here right on her lumbar spine. She gets a nice decompression. It's very soothing for these compressed discs. And look, you probably see it as I direct her hips. You're going to see the leg length, especially on that right side, it gets longer every time it decompresses. So it's just opening up that disc, normalizing the leg length, very soothing. Now another area due to the compression is right where Joni's diaphragm is. So her diaphragm is on the front side of this bone. This is her L1 and T12 vertebrae. And there is a lot of decompression happening there. How does that feel, Joni?
Ooh, yeah, it feels good when you're stretching it.
Good. And that's going to actually help her breathe better. So we're going to take some deep breaths to really try to open that up. Good. And we get about 20, maybe 30 pumps. Sometimes Joni comes in real hot. We might leave her on this table for a good 5 minutes, just relaxing. Okay, good. Awesome. Now, we get good decompression in the knees, in the low back, but what we want to do now is get some opening up in the hip joints. So go ahead and lie on your back. There you go. We're doing okay?
Yes.
All right. And you're going to feel more spasm, more adhesion, so balled up in that tissue on the anterior muscles of the hip joint. Remember, that leg length was long on this side, so every time she walks, it jams up more pressure into that hip joint. So even though this leg was longer than the other one, we actually want to decompress it. We want to open it up with a good old-fashioned chiropractic Y-axis traction adjustment. So that's going to be quick. Just relax. Good. And then just as a bonus, this one's a little bit more gentler, just to keep both hips moving nicely. That was very good. Okay, go ahead and sit up. There we go. And now we've got all that neck tension and compression we want to decompress. So I'm going to have her turn right around, come all the way to the edge of the table here. I think you're good right there, yeah. And relax there. Good. And Joni is one of the softest hearted people you'll ever meet, but man, she's got the spine of a lioness. It is just rigid and tough here. So what we want to do, right on that right side more so, is we're going to do a traction adjustment, a Y-axis adjustment of her neck. So Y-axis, the axis along the spine, we want to decompress, to open up. So go ahead and lift your head up. I'm going to have you pull your hair out right there. I think we're good. And then drop your head down. Good. Good. So first we're just going to make sure her neck and shoulders are nice and balanced as we traction straight along here. And I can feel the paraspinals of her neck, her jaw, everything just sinking in, relaxing. I can see her breath relaxing. Each traction should be pretty soothing. How does that feel? Good. And then to get down to the depth of the joint, we want to give a little impulse at the end, which can also cavitate, so things can actually click open in the joints. So take a deep breath in and let it go. And a little bit more.
Love that.
Good. Nice. All right. How'd that feel?
Nice.
Nice. Just gonna retest here. All right. Much more relaxed. We just want to decompress the shoulders. Beautiful. And Joni should be about an inch taller after this adjustment. So let's go ahead and take a look here. Go ahead and stand up. Come on over.
Oh, yeah.
So,
boy, I love that.
how did that feel?
Feels good.
You feel taller?
Yes, I
Are
do.
you floating on a cloud right now?
Yes.
Yeah? Okay, so
Yes.
spine is straighter. Side effects can include messy hair. You want to watch out for that one. But otherwise, yeah, you did a great job.
Okay.
So,
Thank
all right.
you.
Till next time.
Thank you.